All right. Thank you so much, Amelia, for agreeing to come onto the podcast. I am really excited to talk about this topic. It was really fascinating and interesting to me. So, why don't you start off by telling us about yourself and your work and your family, if you'd like?
Sure, absolutely. So I am a drama therapist and a certified coach here in the Bay Area in California.
Okay. I'm
And
on the
I'm
opposite coast. I'm in Virginia.
Okay, great. I'm from South Carolina originally,
Okay.
so I heard your little twang. I know it quite well. But I'm out here now with my husband, who's from here originally, and then we have two daughters. We have an 8-year-old and a 3.5-year-old.
Okay. Okay. All
Yeah.
right. And you said you are a drama therapist and a certified coach. What does that
Yes,
mean? What do you do exactly?
that's a great question. I'm going to try to give you a brief answer, and then
Uh-huh.
if there's more you want me to share, I'm happy to do that.
Okay.
Um, so, um, so drama therapy is it's a modality where we use the sort of acting and theater techniques therapeutically. So often people have heard of art therapy or
Uh-huh.
music therapy. Often
Yep.
they're more familiar with those.
Mm-hmm.
So the master's program that I went through is a very similar, it's like a counseling psychology program like
Uh-huh.
any other.
Uh-huh.
And then on top of that, you're learning the sort of drama therapy techniques that you would also use with clients.
Gotcha.
So like the first like internship that I did when I was in graduate school,
Uh-huh.
I worked with incarcerated folks at San Quentin. They have a Shakespeare
Mm.
program there.
Okay.
So they put on these shows
Right.
there.
Right.
And that was a really interesting experience because as you can imagine, it's an environment where there are certain kinds of like expression that
Mm-hmm.
are maybe more vulnerable or not don't feel so emotionally safe.
Yeah.
But if you give someone a character, right, that's maybe a
Right.
little more feminine or a little silly or a little,
Right.
weak, quote
Right.
unquote,
Right.
there are facets of themselves that they can explore and express without it feeling quite so close, right?
Gotcha. Okay.
Um,
Okay. All right.
so the work I
That
do now is not so performance oriented, but it
uh-huh.
was a really good learning experience for me to be like, okay, what does it mean to kind of meet people where they are and
Yeah.
give them a way to explore parts of themselves that maybe, regardless of, it doesn't have to be prison, but whatever environment they're in or grew up
Mm-hmm.
in, for
Mm-hmm.
whatever reason, it didn't feel safe to explore this. How do we maybe create a situation where it feels
Mm-hmm.
safer? And
Gotcha.
what can we kind of learn from that?
Gotcha. I love it. See, I do this podcast obviously to bring people who are pregnant and having a baby information, but I also do it because I like to learn new things too. So,
Totally.
so, so that I've learned something new today. I didn't know what drama therapy was, and so
Yeah.
that you're trained as a therapist. Like you
Yeah.
didn't just open up TikTok or Instagram or whatever and say I'm a therapist or I'm a
No.
coach. You actually did training for it.
Yes.
Yes, yes. And I think that's important. I like to highlight that, especially in this day and age where there are
Hmm.
a lot of people who are calling themselves coaches or providing information. I just
Hmm.
want my audience to know, and people can do whatever they want to do, but
Absolutely.
I just want my audience to know the information that they're getting, like who they're getting it from and what their background
Absolutely.
is. And you are trained at master's level in your work.
Yes.
Okay. All right. Love it. Love it.
Absolutely.
So, what led you to become interested specifically more in birth work?
Yeah. Yeah. So a lot of things. I
Mm-hmm.
think that the primarily it was my own postpartum experience, my own birth
Okay.
and postpartum experience with my
Sure.
first child. So she's
Right.
8 now. So it's been a
Okay.
minute.
Right.
But
What
I was
happened?
yeah, so I was already a therapist.
Mm-hmm.
And obviously I, took a break from that work when I
Mm-hmm.
had my child. And I remember, like, I think if I were to say one moment, the thing that happened is Vera, my older daughter, was probably about a
Mm-hmm.
week old.
Okay.
And my husband, I remember, like, he looked me in my eye and he was
Mm-hmm.
like, "How are you?"
Mm-hmm.
And, like, really asked me. And I remember just being surprised by what came out of my
Mm-hmm.
mouth because I said to him, "I feel like I just got back from a war and everyone else
Mm-hmm.
is acting normal."
Mm-hmm.
And like my therapist brain was like, let's note that.
Right.
Like, like,
I
I was
should
like,
remember
seems
that.
kind of
Yeah.
important. Like,
Yes.
I was like, I'm in the thick of it right now. Like, I kind of
Right.
knew, like, I can't really deal with that right now,
Right.
but we need to come back to that.
Sure.
And I'm not comparing my birth experience, right, to a literal war, but that was
Mm-hmm.
like the emotional, like, texture of it
Mm-hmm.
to me was that I had come back from something that had changed me.
Yes.
And I didn't quite know how to articulate that,
Right.
but it wasn't
Right.
just, oh, now we have this new person.
Right.
Something had happened inside of me in
Mm-hmm.
terms of my own identity and my own
Yeah.
experience in the world
Yes. Yes.
that I didn't know a name for,
Mm-hmm.
and that like wasn't being reflected back to me in a
Right.
way that I could understand. Like my
Right.
family and my people are so kind, and I feel
Mm-hmm.
very lucky. And I now that I work with folks in the perinatal time, I know how broad the experience can be in terms
Mm-hmm.
of how met or not people feel by their
Yep.
family and their village.
Right.
So like very grateful for that. And basically it was like, how's the baby? Isn't this wonderful?
Mm-hmm.
And there was a part of me that really resonated with that. And then there was another part of me that was like, I'm going through something huge.
Right. Right.
And I didn't know to expect this.
Sure. Sure.
And
Sure.
that I have now come to learn
Mm-hmm.
that is part of it for many of us.
Mm-hmm.
And without that context, we feel like, what's wrong with me? Or what's
Gotcha.
happening to me?
Right. Right.
And so now that has become the focus of my work with moms and parents is like,
Mm-hmm.
nothing's wrong with you.
Right.
This feels huge because it is.
Yes. 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 And you are a new person after you have a baby, whether
Completely.
you realize it or not. Yeah, absolutely.
Yeah.
So then what is birth story medicine?
Yeah, great. So birth story medicine is it's a methodology that was developed by a midwife. Her name is Pam England.
Mm-hmm.
And she has a birth story school where she teaches this method with some other folks that she's trained.
She also wrote, what is the book she wrote?
She's
Why
written
am
a
I
couple
blanking?
books. Yeah, she wrote Birthing from Within.
Yes, I love that book.
Yes, yes.
Yeah.
And she has several others now too. And much of her work is about this kind of idea that birth, right, is this initiation. Birthing is a developmental process that we
Right.
move through
Right.
on an identity level, right? It's
Sure.
not just like, oh, we have a baby, right?
Right.
But birth story medicine is this sort of process that as a drama therapist makes a lot of sense to me. I didn't know it existed when I did that training, but it's a very good fit for me because it's basically a form of kind of like storytelling where when folks come to me to do that processing work, they know they're coming to talk about their birth.
Right.
And often there's some piece or pieces of the birth that feel unresolved for them.
Got it.
And rather than just telling the whole story, which I think we probably all know in social situations, sometimes people will tell the birth story or
Right.
people will ask about the birth story.
Right.
And so many of us have told and heard these stories over and over again, but not a lot of processing tends to happen there. It's just like this kind of like spewing of
Right.
this experience.
Right.
And I think that's because there's a need to be witnessed in how big this experience is, whether it's unresolved or difficult or not.
Right.
I think it's a big enough experience in our development that there's just a need for it to be seen and held in a certain way.
Right.
And I think there's evidence of that by the fact that like when you're pregnant and you're just like trying to go about your day, people will be like, I'm going to tell you about my birth. And it's like,
Right.
no, you're not.
Right.
I think that happens because of our need for that and our lack of spaces where that actually can happen in a held way.
Mm-hmm.
So anyway, birth story medicine is, it's this process where, and there's lots of people who do it. I'm not the only one, but when people come to me, they know we're going to talk about the birth, and basically without going into all of the nitty gritty, the core of it is there's what happened, whatever happened during the birth.
Mm-hmm.
And then there's the meaning that gets assigned to it, right? So often the work we're doing in birth story medicine is helping people untangle, okay, so this moment happened where you felt like, let's say this intervention happened that you didn't want to have happen. I'm making this up.
Right. Right.
And then the story you told yourself about it is, if I had advocated more, right, that wouldn't have happened. So then the belief is, I'm weak.
Right.
So then what you carry forward from that is, I'm weak. Probably you carried the story of I'm weak into the birth. which is probably why you interpreted it that way to begin with, if we really go back.
Gotcha.
But often what we're trying to do in this, and I'm not telling them the meaning that they're assigning, but I'm helping them explore, okay, so what did that mean about you? What do you believe it means about you that it happened that way?
Right.
Because those beliefs that get kind of planted in the meaning of it that we make about it, those are the things that I think really hold us back and keep us stuck, and actually make postpartum and many things after that much more difficult than they need to be.
Yeah, absolutely.
So when I can do the work with people where it's like, okay, so that happened. We don't get to change what happened at the birth.
Right.
And sometimes that's part of actually the deeper work is, okay, if I let go of the story that I'm weak, or the story that if I had done something different, this would have gone differently. Then we actually have to deal with the grief and sadness of maybe we don't get to control how it goes. Maybe that's just what happens. Right. And so I think sometimes these stories we tell about ourselves are kind of self-protective. Like if I can figure out what I did wrong, quote unquote, the next time, whether it's birth or some other experience, I can avoid these hard feelings. Right. But some of it is like, we don't get to sometimes. Especially birth. I'm like, we just don't get to plan how that unfolds.
Right.
And so when we attach how it unfolds to like how good we are as parents, it's a really terrible setup.
Yeah, 1000%. Yeah, definitely. So then I guess, I mean, you kind of touched on it, but then it sounds like it's really important that we process our birth stories. So why is that important? And then if you don't do it, then what could happen?
Yeah, I mean, I think that's the piece of it that's really important is, certainly for folks who, when folks come to me, they usually know that they're stuck about something, right? And obviously there's some people who have a birth experience where they're more or less okay, which is great, right? I love that. I want that for all of us.
Sure.
And for a lot of folks, that's not how it goes. And I think there's for many people, I don't want to say all, but for many people, the basic issue is they had expectations about how the birth was going to go or should go that often they weren't even consciously aware of until they did not get met.
Gotcha.
Right?
Gotcha.
And then they're on the other side of the birth experience going, that wasn't what I wanted. And I'm feeling some type of way about that. Gotcha. But I think what's hard is, let me see if I can articulate this I think for a lot of people, the birth experience is sometimes the first real confrontation with like the fact that control is an illusion. And given that you just had a baby, you're going to confront that over and over and over. Now. As an initiation into parenthood, it's very well designed.
That's true.
And also it's very hard. Right. And so I think what happens is the birth experience in a very beautiful, but also kind of brutal way serves us exactly what we need to become parents. And if we don't take the opportunity to do that work, then we're going to get it over and over.
Right. Until we get the message that.
Right.
Yeah.
And it is painful no matter when we choose to do it. Right. And I think it's the most painful when we keep not choosing to do it.
Sure. It's like the old saying of like, God or whatever you believe sends you a message, and first it's a rock, like a little pebble, then it's going to be a rock, then it's going to be a brick, then it's going to be a boulder until you like your attention is
exactly.
Yeah.
And I think it's tough, right, when we talk about it in this way, because I don't ever want to imply that like, right, there are obviously really there can be very hard and traumatic things that happen during birth. And I don't want to say that like those things are meant to be like certain lessons for certain people, right? There are horrible things that happen in the world, birth included. And I'm not trying to be like, what's the gift? What's the lesson?
Sure.
What I'm trying to say is there is an initiatory experience for all of us, even when it goes well. Yeah. That if we're paying attention, has challenging elements.
Sure.
And I think the more we allow ourselves to be challenged by that, the better off we are in the long term.
Yeah, yeah, for sure. Now, I'm curious, obviously you can't say specifics, but do you find like a lot of the people who you work with, is it that they had like a specific laid out birth plan and nothing went according to plan, and they weren't prepared for that possibility? Or is it like, I didn't want to get an epidural and I ended up with an epidural, or I had a C-section and I didn't want a C-section, or what are some of the things that you see?
Yeah, I see a lot of things like you're naming, right? A lot of
Mm-hmm.
things like even using the language birth plan. I know some people are starting to soften it to birth preferences, which I like
Mm-hmm.
better. But like even plan, I feel like is so misleading
It's very misleading. I tell people all
because
the time, like, you can't plan. The
I'm
only
like,
predictable thing about birth is that it's unpredictable.
right, like
So,
please know for sure,
right.
right? Um, so so yeah, part of it is the idea that if we prepare in some right way,
Mm-hmm.
that we get to have the experience that we want.
Mm-hmm.
I think the other thing that's really challenging for folks sometimes is this idea that they even know what they're going to want.
Mm.
Because I think that's another piece of this that we don't talk about in a particularly useful way. Is and this is one of the things that I find really, this is a real challenge for me in doing
Mm-hmm.
birth work. And I
Mm-hmm.
think probably for many of us as providers, I would be interested to know if this is universal for us, is
Right.
like how to be more honest
Mm-hmm.
and more direct,
Mm-hmm.
especially with folks who have not yet had any babies, who are
Right.
having their first birth
Right.
experience,
Right.
and then postpartum experience after that. How to be more direct and honest about what it might be like without like trauma dumping or fear mongering.
Sure.
Because I think that there's a fragility that we project onto pregnant people and
Mm-hmm.
onto women in general,
Mm-hmm.
let's be clear, that is actually doing them a lot of disservice when they actually meet the moment of labor,
Mm-hmm. Mm-hmm. Mm-hmm.
where we don't want to worry them, we don't want to scare them. But then actually what happens often is they're in that moment like, holy, oh my goodness,
Right.
no one told me it was going to be like this.
Right. Right.
And then
Right.
it's like we actually haven't really mentored them in a very loving way because they're right. We didn't tell them it was going to be like this.
Mm-hmm.
And some of it is because I think in terms of like the way initiation works is you learn it by experiencing it,
Mm-hmm.
right? If we could tell you it, then we could just tell you it. So I
Right.
think part of it is that it's not conveyable by talking about it, but I think part of it is that we're scared to scare people.
Sure.
And
Sure.
so I think it's like always trying to find a way to be like, and then this is a bigger conversation, but I think it's also about the way that the messages about birthing are so polarized,
Mm-hmm.
right? So there's, if we, and this is reductive, but if we think about it as like two different camps, right? If we think
Mm-hmm.
about a like highly medicalized message that's like,
Mm-hmm.
birth is an emergency, we're going to manage it. We, the professionals, are going to do it. You're just here. We'll let you know when you and your baby are safe, right?
Mm-hmm.
Or we think about, right, the other side of it, which I think they might call themselves a sort of natural birth community, but I
Mm-hmm.
just want to say that all birth is natural. And so
One
I don't
thousand
want to put it
percent.
over there.
Yeah. Mm-hmm.
But if we think of the opposite of whatever the highly medicalized version is, I
Mm-hmm.
think that message is very much like trust yourself, trust your body, trust birth. Your body knows how to do this.
Mm-hmm.
And I'm not saying that those things aren't true. It's just, I think it leaves birthing people in a position where they either have to choose, okay, it's all fear or it's all trust.
Yes. Yeah.
And it's not one or the other. It's an
Mm-mm.
experience in honesty for most of us that involves both.
Mm-hmm.
There
Mm-hmm.
is fear in the experience, there is trust in the experience. It is an organic, ordinary, ancient thing, and it is scary and edgy and intense.
Right.
It's all of those things. And I think
Yeah.
because we don't know how to talk about it with people in a way that is more whole and more true,
Mm-hmm.
we are sending folks to this experience deeply unprepared, very
Mm-hmm.
informed
Mm-hmm.
in a certain way,
Right.
but very underprepared.
Right. Right.
And I think that is a part of what I grieve about it, both as a parent and as a provider, is I want better for all of us.
Sure. 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 Yeah, it's really tough because both camps are, and it's very much so. People, they're both sides, and both sides are wrong, like 100% wrong. There's something in the middle, so to speak,
Right.
and especially when you have the highly medicalized version, like birth is an emergency. It's that sets people up for interventions that they
Right.
probably and often cases don't need. The trust yourself can lead you to down a path of not getting interventions when it may
Right.
be the most appropriate thing. So that's certainly a lot of what I do is try to present sort of here are the things, here are the options, or here are the possibilities that can come. But you're right, it's definitely a balance of helping people know what possible things could occur, but also recognizing the beauty and that it can be a great experience. So there's definitely a balance and something that we all go through. Is there anything that you think people can do during their pregnancy to help prepare themselves better for managing that? Because yes, there is
Yeah.
some certain element of you don't know, you really don't know until you're in it. But like anything else, like your first hike or your first drive or your
Absolutely.
first anything, you can still go into it even if you haven't done it before
Right.
with some preparation. So what are some things that you recommend that people can do during their pregnancy to help shape their birth story to be a more positive experience?
Yes, I love this question. Um, so I have so many like light bulbs going off in my brain. I'm
Yeah.
not sure where I want to start my answer, but the first piece is I love that you said hike because I use that analogy with pregnant folks a lot as a way to kind of bridge these two extremes, right? Like if we're talking about the polarization in the messaging around birth, it's
Mm-hmm.
like if we take this extreme on like the highly medicalized version,
Mm-hmm.
it's like if you imagine being at the bottom of the mountain, that side is just like we're just going to airlift you in a helicopter, take you to the top. You can't do any of this, right?
Mm.
The other side is like you can walk, right? Go, right?
Mm-hmm.
So what I say to pregnant folks is you can walk, right? I mean, and that doesn't mean that we would not train and think about who
Mm-hmm.
who I am. Even if I've never hiked this mountain before, I've done other
Right.
challenging things before, right?
Sure.
And I know myself well. So I
Mm-hmm.
actually I run this group coaching program for pregnant folks. It's called Uncharted.
Mm-hmm.
And it's about preparing for birth, right?
Mm-hmm.
Not deciding how the birth is going to go, but how do I want
Mm-hmm.
to show up for it?
Mm-hmm.
And much of the work we do in that group is about like, okay, what's my relationship to like pain,
Mm-hmm.
discomfort? What do
Mm-hmm.
I know about how I cope with like
Mm-hmm.
challenge, right?
Mm-hmm.
Like, and that, we don't know how the labor is going to go, but if we think
Mm-hmm.
about it as a hike, it's probably a situation where there's going to be less opportunity for rest the further we get into it,
Mm-hmm.
which is not a great design, but here we are,
That's
you
what
know?
it is.
And,
That is the reality. Yep.
and I'm not going to be able to get my MapQuest directions and be like, how long is it? I'm
Right.
actually not going to get to know that,
Right.
right? And
Right.
so, what are the water stations that I know work well for me,
Mm-hmm.
right? Who are the people or the tools that I know are not my jam,
Mm-hmm.
right? They
Mm-hmm.
should not maybe be hiking with me,
Right.
right?
Right.
And
Right.
that there are things we can do because I think that's part of the, for me, the like empowerment piece of this is like, yes, if you haven't birthed before, and even if you have, every time is another
One
thing,
hundred percent. 100%.
And so there is something about, I think there's something about having reverence for the beginner's mind of that.
Mm-hmm.
And I do know myself. And I think letting clients, letting birthing people bring the full knowledge of who they are
Mm-hmm.
into that experience
Sure.
and be like,
Sure.
okay, what are the like and even what are the stories and the messages that you're carrying about birth,
Mm-hmm.
from your
Mm-hmm.
family, from your culture, from your traditions, your
Yes.
religion,
Yep.
what's gotten in there in terms of these two, camps that we've been talking about. What
Right.
of this do you even believe? What is
Right.
yours?
Right.
And whatever isn't, maybe let's not bring it in there.
Mm-hmm.
Let's certainly not let it write your birth plan,
Sure. Sure. Sure.
and very similar, I think, to the way we make meaning of experiences and the way we were talking earlier about this. It makes me think about like people, hiking mountains or
Mm-hmm.
or running marathons. People don't just do that because they want to suffer.
Right.
People do those things because they're meaningful to them, right? Because meeting those challenges and doing something that brings them to the edge of themselves changes the story they tell themselves about who they are.
Right.
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 And so that's the other piece of this, is that when we don't have that same reverence for the journey of birth and postpartum, actually, and parenthood, period, we lose the ability to actually give ourselves the gift of actually how amazing what we're doing is.
Right.
So we're in the suffering and the shame and the self-blame of not having done it better or differently or whatever. And we don't actually even get to integrate, like, wow, however I got up this mountain, here I am.
Right. Right.
And there's something about that I think we are meant to have too.
Yeah. 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 And we also don't give enough to use the word reverence like you use, that like a good part of the hike is growing a human inside of your body.
100%.
Like you have grown an entire human being. That is not like a small feat.
No.
So just even recognizing that in and of itself is really, really important. So, yeah, these are all just really important things to, and is it fair to say like this, you can't, even if you do this work and you do the things, you can't guarantee a specific outcome, but what it does when you think about it this way is to help you deal with whatever outcome is presented to you without it kind of like derailing you or like, what, I mean, is that fair to say?
Absolutely. And I think even doing the work of noticing, like even the preparation work where we look at, what stories am I already carrying about birth, right? What, and some of it is hard to look at, and it's important that we do it with as much compassion as we can, my friends or relatives or people who've given birth, maybe if I haven't before, what have I told myself about their births, and what are my thoughts about, breastfeeding versus not, or having a cesarean birth or a vaginal birth, and what judgments have I carried about those things?
100%.
And being like, okay, I got that honest, right? We're all swimming around in the same water with the same messages about that.
Yeah.
And going, okay, so, but I think even having the awareness, we're all carrying stories around about all of this. Then postpartum, I can go, okay, the story I'm making up about the fact that nurse didn't like me, whatever.
Right.
Even just having the awareness that I'm making up all these stories all the time. We all are. Gives me some space where I can go, do I want that?
Right.
Because I don't get to prove it. It's not like I'm going to like go back and like go back into that moment and like study in the lab, like if that nurse likes me or not.
Yeah.
Like it's not happening. It's only happening internally. And it's like, I don't know if that's true or not. And I know for sure it's not serving me. So what if I just let that one go?
Right. Right.
So I think just even having that awareness that we are choosing so much of this allows for some breathing room.
Absolutely. So then how, speaking of like postpartum and being in the postpartum state, so you have this new baby, you're trying to enjoy this new baby, but you're doing this birth story work where you're processing. How do you balance the two where you're like not so focused on like the past and what happened, but you're able to, and maybe that's the goal of therapy, period, because there's a processing period, to like how you're not so focused on the past, but you're able to enjoy the moment and the fact that you do have this beautiful baby. So how do you reconcile that?
Beautiful. Yeah. I think this is such an important question, because I think often we have this idea that like when we do processing work or when we revisit things from the past, whether it's birth or whatever else, that like that is taking us out of the present moment, right? And I think the opposite is often true, right? Like when we think about like, I'll try to give you an example, but like
sure.
when someone gets like triggered, right? What that means is that I'm in a present moment here with you. And the trigger is when something in this present situation reminds some part of my survival brain, basically, of something that happened in the past, right?
Right.
If I can go back to that thing that happened in the past and process whatever's left over there, then that means I'm not going to get triggered in the present.
Gotcha.
Which means I don't have to time travel.
Sure.
I can actually stay.
Gotcha.
So in some ways, it's kind of a paradoxical thing, but I'll try to give you an example because I think it's just so much easier in the concrete. So let's say, I'm going to make this up, but let's say that in the first grade, I couldn't stop talking in class. And let's say that my teacher got frustrated and she like made me go sit in the hallway.
Mm-hmm.
And let's say that I felt all of this like embarrassment and shame and I felt alone. And let's say when I explore that, I see that the belief that got rooted in then was like, I don't belong. I'm going to make this up. And then fast forward to, I'm now in like a postpartum moms group and I'm having trouble breastfeeding and I'm now formula feeding my baby because that's what I need to do. And I'm not going to go into my rant about how fed is best. And I want everyone to know that. But what's happening is my impression is that the other moms in the group are breastfeeding and I don't get to do that.
Sure.
Right. So then what happens is what may get triggered in that moment is this age old story in me that I don't belong.
Gotcha.
Right. So then I'm back inside. I might not even know it consciously, but I'm back inside of this really old, actually past belief about how I don't belong. Whereas if I can do the work with a therapist or someone to trace that back and go, oh, okay, I'm an adult now.
Right.
I can go to that 6-year-old part of me and go, listen, you were talking, you were 6 years old. It was the first time you had to sit for hours on end at a desk.
Sure.
You now, as an adult, can understand that teacher had 30 kids to look after. I'm sure she was overwhelmed.
Right.
But that was not your fault. That never meant you didn't belong.
Right.
How about let's let that go?
Gotcha.
I mean, I'm doing a very simplistic version of this.
Yeah, but no, I totally, I get it. Yeah.
So then fast forward, I'm in the moms group. I might still have really hard feelings about the breastfeeding journey. I might still be, I'm allowed to have feelings about that, right?
Sure.
But maybe I get to stay in that present moment and have those feelings.
Right.
Rather than having this past thing about how I don't belong.
Yeah. Gotcha.
So I think the processing is connected to us getting to be present.
Okay. That makes sense. So do you think everybody needs to process their birth story?
I don't think I would go so far as to say everybody. I think people know when they have something that they need to process, whether it's birth or not. And I think that looks usually one of two ways. Usually people are experiencing like intrusive kind of thoughts, almost kind of flashbacky things they can't let go of. Or people are having the opposite where they can feel themselves like avoiding thinking about something, really actively avoiding it.
Yep.
Usually those are signs that something needs some attention from us.
Gotcha.
When we can give it, sometimes people come to me to do birth story medicine work, and their kids are a couple years old. I mean, sometimes that's as soon as people can take a breath.
Right. I was going to ask, at what point do people usually come to you?
And sometimes people will come and they'll be, they'll have a, 6-week, 8-week, 3-month-old baby and anything in between.
Got it.
It's usually not earlier. Usually when folks have come and their baby's a month old or less, I will often like listen and do a session of just like being with them. But usually I don't do the birth story medicine that early because it's still so fresh. There are things that are still like landing from that experience. Or sometimes we'll do a little bit and then we'll meet again in 2 months and they'll be like, okay, now this.
Gotcha.
So I can kind of feel usually where we are in it.
Yeah. Yeah, that makes sense. Makes sense. Okay, so then as we wrap up, is there anything else that you want to add about birth story medicine work before I ask my last few questions?
Let's see. I just love it so much. And I think the other piece is that as I've been doing that work, which I love, I've been thinking a lot about this kind of like preventative medicine, if you will, work, which is why I've been now kind of starting to do this more work with pregnant folks. Like starting to ask myself the question, like, what might I be able to do where people would never need to come to me for this?
Gotcha.
And again, I'm still struggling with like quite how to answer that question, but I am loving working with pregnant people and starting to kind of explore what does it mean to prepare for this in a different way.
Sure. I love that. So then what is the most frustrating part of your work?
I think it's the struggle that I mentioned earlier about how much to share, how directly. Like I don't know how much you hear this, but when I work with folks postpartum, I almost always hear some version of like, nobody told me.
Yeah.
Nobody told me it was going to be like this.
Right.
And often they're talking about like postpartum. Sometimes they're
Mm-hmm.
talking about labor itself,
Mm-hmm.
but there's this over and over this refrain of like,
Mm-hmm.
then I had my child, and then people came out of the woodwork and were like talking about all these complications and all these feelings and all these
Right.
experiences.
Right.
And all these
Right.
people were in my life before and nobody told
Right.
me.
Yeah. Yeah. Yeah.
And so there's something there that I haven't cracked yet
Mm-hmm.
because,
Mm-hmm.
again, because of the role that I'm in, right? I'm not these people's like girlfriend, you know?
Right.
So there's
Right.
also boundaries about what I would share in
Sure.
what way.
Sure.
But I think the frustrating part of my work is finding the balance between really wanting to there's something about, and this is rooted in my own like sort of political worldview and in my own feminism and in my own sense that we don't treat women like humans or like adults, and then we expect them to birth and parent like adults.
Right. Right.
Then we're surprised. And I think there's a great disservice that we continue to perpetrate against women and against mothers.
Mm-hmm.
And along the same lines that women continue to believe that there is something wrong with them, when actually there is something wrong with all of us. There is something wrong with a system that makes women, and particularly women of color, and particularly women of lower social economic classes, like there's a whole caste system within it that, and I felt this way, working in with incarcerated folks as well. And that's not to say that there aren't some problems are individual problems, but none of them are happening in isolation.
Right.
They are connected to systemic problems that when those are not named, people think, oh, I'm the problem.
Sure. Yeah.
And I'm like, why are you the problem when we're the only developed country that doesn't have paid parental leave?
Right. Right.
Like,
right. Exactly.
Why are you the problem when like Black mothers are continually disbelieved and getting worse care and worse outcomes? Like it's the math is not mathing
at all. Yeah. Yeah.
And so like I know I'm on my soapbox now, but I'm on my soapbox because all of it is connected. And because 100%. When I sit across from women and mothers and families who are in deep distress and believe that it's because they're doing something wrong or they missed something, when we continue to settle for a world that isn't good enough for us or our kids, it's not okay with me.
Yeah, I hear you. I hear you. Well, then on the flip side, what's the most rewarding part of your work?
Yes. Well, I think the most rewarding part of my work actually is that the very flip side of that is that I get to be at least a small part of hopefully people's awakening to the idea that the fact that some of this is hard is actually not because there's anything wrong with them.
Yes. Yeah.
And that is so beautiful. And
agree.
It's so, I mean, I'll never be sick of it. I love it so much.
Yeah.
And
for sure.
It's like, I think one of the things that always stands out to me and that I find so beautiful is like being a parent in this particular moment where I think we're having this reckoning as parents, where there is this sort of turning point where I think as parents, we're starting to just generationally be like, I want to do this differently, right? And when I see parents with their kids and with my own kids, I see us out here being like, with our kids being like, it's okay to have big feelings. I see your big feelings. There's room here for your big feelings. There are no bad feelings. I'm going to be here, like, and in some ways it can feel so small, but it actually is like a very revolutionary thing. The way that I think we're making room for our kids to be fully human.
Yeah.
And what I love about the work that I do is like being able to advocate for and being able to remind, hopefully all of us, that we get to have that too.
Mm-hmm.
Right? That that's not just for our kids, right?
Right.
And we're not just teaching them that by giving it to them. We're also
Yes.
teaching them that by doing it for ourselves,
Yes.
right? By
Yes.
going like
Yes.
this, at least for me, I'll speak for myself, the parenthood journey is incredibly joyful and beautiful. And also there are things about it that like I do
It's
not love.
hard. Yeah.
Like
Yeah.
I love my children immensely,
Sure. Yeah.
but like there are things about this job that are like
Yeah.
0 stars. Like
Yeah.
I'm
Is it
not like
like,
waking up in the morning like I can't wait to pack these lunches. Like, ooh,
yeah.
like love
Yeah.
this. Like,
Exactly.
you know, and I think normalizing it, there are pieces of it that are like frustrating, tedious,
Mm-hmm.
boring, not my
Mm-hmm.
thing.
Mm-hmm.
And letting that be okay,
Right.
right?
Right.
And giving us all permission to have mixed feelings about all of it because we
Mm-hmm.
do, right? Like we
Right.
don't not have those feelings because there's no permission to have them. We
Sure.
just have them
Sure.
secretly and feel like I'm bad and everyone else on Instagram has it figured out. But the
Yeah.
truth is
Yeah.
all of us have it mixed up and don't know what we're doing.
Right.
So the
Right.
most rewarding part is to sort of like let that cat out of the bag
Mm-hmm.
and feel with everyone this commonality that we're all just like muddling through it.
Sure.
And then I think the parts that feel really good and are beautiful, we get to fully feel them because we're not all
Yeah.
wrapped up in like secret shame about the fact that some of it is hard.
Absolutely.
course it is.
Absolutely. Yeah. Yeah. So then what is your favorite piece of advice that you would give to an expectant mom?
Hmm. Oh my gosh, there's so many things. I'm like, I don't know. Um, I think we've been talking about, I run this postpartum moms group and we've been talking a lot about this. So this will be the one that I share today, which is, um, people often ask me about like, how do I set boundaries with family? And like, they do these things I don't want them to do, but then it's like my parents, they didn't live with me. And so then they're like, but I did this with you. And then there's this whole thing. And, so I started in the moms group, letting people write these like short sentences that are like scripts that they just say over and over. So they don't have to know what to say in the moment. And so like, that's my best advice right now is like, someone, a relative will be like, well, we did this with you.
Right.
And like I recently had someone in the group who wrote the script, and I think what she wrote was, I think she wrote, we talked to our doctor about that, and that's not how we're doing it.
Okay.
And then she just said that over and over to everyone about everything.
Right.
Instead of arguing for like 15 minutes.
Yes. She said this is she dumped it off on somebody
Right.
else.
She's like, I throw my
kept
doctor
it
under the
moving.
bus, and then I
Yes.
just keep it moving.
There you go.
And I was like, I love that for you.
yes.
I was like, I'm going to tell everyone to just throw.
And I can tell you, your doctor's happy to be thrown under the bus.
Right. I was like, your doctor is unconcerned. Your doctor is
Yes.
busy. Your doctor's out there doing stuff.
Yes.
Yeah. Because
Yes.
I think a
Love
lot of, especially in the like raw, like first 2 months, it's like
Mhm.
even the cognitive parts of your brain that can have the debate about it are so tapped.
Yeah. Yeah.
And like
you're
other
just
people
like,
getting their feelings like you're criticizing them and you're like,
Yeah,
I'm
and you're
really
just like,
not. Just,
yeah, it's just-
please use the blue passy and don't talk
Yeah.
about it anymore.
Yeah, and just there you go. So where can people find you? What are the things that you offer? Do you have things virtually? Tell us about that.
Yes, happy to. So you can find me at my website is birthingforreal.com.
Okay.
And let's see, I have a program for pregnant folks called Uncharted. And it's about like navigating the kind of wild terrain of birth. So it's some of the work we talked about earlier in terms of like how to prepare yourself for that experience rather than planning how that experience should go. And it is virtual. It's 6 weeks and it's usually a small group and we meet weekly. And it's like 90-minute live sessions. And then we have like outside materials and kind of homework that folks do. And then we get back together and kind of discuss and do exercises together.
Okay.
And then at the end of it, people have what I call a birthing support plan. And so
Mm-hmm.
it's like a blueprint for how they want to move into that experience and what support they want in place rather than what they want the birth to look like.
Gotcha.
So that's really great and I love it. And then I do restorative medicine sessions and that's all there. I also have a newsletter which you can sign up for there called
Okay.
Soft Cheese, which
Uh-huh.
is a pregnancy and birth newsletter.
Uh-huh.
Um, and it's about weekly, not perfectly weekly, but about, and it's like just things that I write about from all kinds of things like historical and cultural trends in birth and
Uh-huh.
how that has changed over time to like
Right.
resources that I love and little exercises that are similar to what I do in Uncharted, but kind of bite-sized versions you can do on your own.
Gotcha.
But it's meant to be just kind of a companion for that time to sort of
Uh-huh.
move towards the birth experience with like hopefully a little more awareness.
Right. Gotcha. Gotcha. I love it. And we'll link all that in the show notes. Well, thank you
Amazing.
so much for agreeing to come onto the podcast. This was a really helpful and insightful conversation, and I know folks are going to love it.
Oh my gosh, thank you for having me.